Hello everyone, in this video we are going to take a look at the mastoid process of the temporal bone and the mastoid part of the temporal bone. So here this is the mastoid part of the temporal bone, and somewhere here is supposed to be the junction between the squamous part and the mastoid part, sometimes forming the squamo-mastoid fissure. This is the mastoid process, and here lies the junction between the mastoid and tympanic part of the temporal bone, forming the tympanomastoid fissure. From this external view of the temporal bone, you can see the mastoid part has got a superior border and it has got a posterior border. This superior border articulates with the posterior 1/3 of the lower border of the parietal bone, and this posterior border articulates with the squamous part of the occipital bone from its lateral angle to the jugular process. Now this external surface of the mastoid part of the temporal bone has several features. First of all, behind the auricle over here you have the attachment of the auricularis posterior muscle. To the margins of the external auditory meatus you have the cartilaginous part of the external auditory meatus and the attachment of the pinna, and you have auricularis anterior, superior and posterior small muscles. Now auricularis anterior and superior are actually attached over the temporal fossa, so you cannot see them, they are attachments on the bone, but auricularis posterior is attached to the mastoid part of the temporal bone. Not only that, still behind somewhere here you have the attachment of the occipital belly of the occipitofrontalis spilling over from the occipital bone. Now to this mastoid process and extending upward you have the attachment of the sternocleidomastoid, splenius capitis and longissimus capitis, three muscles. In fact, the mastoid process itself is supposed to be created by the pull of the powerful sternocleidomastoid when the child actually holds its head up, and this is the tip of the mastoid process, and inside the tip on its inner surface there is a small notch for the attachment of the posterior belly of the digastric muscle. And not only that, further medially you have a groove for the occipital artery which is going up into the scalp. So let us look at it diagrammatically. So here you can see auricularis posterior, occipital belly of occipitofrontalis, sternocleidomastoid, splenius capitis, longissimus capitis, groove for posterior belly of the digastric and occipital artery. If we look at this medial view, here again you can see the inner surface of the mastoid part of the temporal bone as well as the mastoid process, and you can see that groove just medial to the tip of the mastoid process for the posterior belly of the digastric and the occipital artery. What you can make out is that there is a wider groove on the inner surface at its junction with the petrous part. So this is the junction between the mastoid process and the petrous temporal, and just behind you can make out this wide groove. It is for the sigmoid sinus, and this sigmoid sinus runs on the mastoid process. It receives it from the parietal bone and it goes on into the jugular foramen by the jugular process of the occipital bone, and over here you can see the inner opening of the mastoid foramen. Now this mastoid foramen on the outside is somewhere here on the occipitomastoid suture, and it actually connects the sigmoid sinus inside with the posterior auricular vein outside. It gives an emissary vein and also a meningeal branch of the occipital artery. Now if you look at it from the inside, this is the inner opening of the mastoid foramen. So much from the mastoid from inside, and if you look at it here you can see it diagrammatically, the opening of the mastoid foramen and the sigmoid sinus. If you look at the inferior view, again you can see the tip of the mastoid process over here. You can see the tip of the mastoid process here and the groove for posterior belly of digastric and occipital artery. I think that would be enough for the mastoid process. Thank you.